Who is to be blamed for bad governance and bad leadership in our states, in our nations? Who is responsible for millions of deaths that are occurring in the villages because of generally people cannot get access to medication? Who is responsible for accidents in our roads? Who is responsible for theft of public resources in the Treasury, in the Ministry of Health, in the Ministry of Education? Who is responsible for poor quality of education in the nation? Who is responsible for all these ills? Well, somewhere I read in the Article 1 of the Kenyan Constitution 2010 that all power belongs to the people and that power shall be exercised in accordance to the Constitution. The Constitution envisages and portends and presents national values and ethos that the public officers must adhere to. But somehow, our public officers, politicians being number one in the list, do not live according to what they promise. And therefore, when we have rampant corruption and when the health system is not working for us, when everything is turning against the common man, it therefore means that we as a people are not represented effectively in the processes of governance. But wait, in a democratic system, how is the government established? The government is established when people come together and vote and donate their power through the ballot papers or through the ballot boxes or by way of voting. We donate our individual powers and collectively bestow them to a duty bearer, to a public officer, to a president, to a member of county assembly, to a governor, to the Senate or the senator, to the women representative. We donate our power. It therefore means that when we donate our power, then people that we elect, people who are serving in public offices, they hold those offices in trust of the public. And in simple terms, it so means that when that happens, it so means that the public officers have a contract with the public. And during the electioneering period, we are promised good health care, universal health care. When that is not delivered, it therefore means that the person in the office has broken the trust, has breached the social contract that they have with the public. Why is it that public schools are not doing better? Why is it that private schools are thriving and they are more expensive in the country? Does that mean that our public schools are not performing any better? Because I don't know of any rich person, I don't know of any politician whose kids are going to public primary schools in the villages. Show me one in your world. All their kids are in private schools. That is to say that our educational system is malfunctioning, is malnourished. The education system is not healthy. And that is not healthy. It means so that the public, people who hold public offices in trust of the public have breached the contract. Thousands and thousands of people die in our hospitals. People go to public hospitals and they cannot get access to medicine. No proper medication. We are living in a country where if you need proper medication, you'd better go to the private hospitals. And that explains why our public officers do not trust, do not even go to our public hospitals, the hospitals that we hold them in trust to ensure that they work for us. Millions of Kenyans cannot afford the private hospitals. It therefore means that the public officers have breached the contract. Now, in normal sense, what happens when somebody breaches the contract? The contract got to be terminated. The contract got to be terminated. And in cases of embezzlement of public funds, the person responsible must be prosecuted. But where are we? What happens? Do we have people who embezzle public funds and subject millions of people to poverty, to ill health and poor educational system? Yes, we have them. But do we prosecute them? No, we don't. Do we eject them from the offices? Maybe, I don't know. But who is responsible for all these ills? Do you know of any of your relatives who has been frustrated in a public office? Do you know any of your relatives who has died and suffered because of poor medication in the public hospital? Maybe you know, maybe you don't. But how often do we take these duty bearers to account? How often? Do we even care to hold our duty bearers to account? How do we do it? Or are you waiting for somebody to do it for you? As a responsible citizen, it is paramount that you start reflecting on these things. It might be okay because it's your neighbor that is affected, but it will pain you so dearly someday when this thing will knock right into your door. You will cry, but you will not have a shoulder to lean on. You will long for somebody to support you, but it will be too late. Some of these things are happening because of our negligence. Let's hold duty bearers to account. Where the law is failing us, it's a moral obligation to make things correct and to make things right. I count on you. I count on you as a person to take full responsibility of ensuring that the government that we put in place works for us, not against us. In my capacity as a member of Center for Africa Volunteers, I commit myself to organize grassroots organizations for civic action. I commit to transfer the knowledge and the education that I have to people who need it the most to act appropriately. Unless we educate people from the grassroots levels, nothing will happen. If we keep quiet when we know that we should act and talk, we are part of the scam. We are part of the robbery. We are part of the political prostitution. We are part of the political sodomy. We are part of the rape that is happening in our land. I believe that we shall take a difference together.